So we have a quick yet dynamic program for you today, and I'm confident you will leave with a strong appreciation for Childhaven's crucial role in supporting the well-being of our community's most at-risk, marginalized, and vulnerable children and families. I'm also hopeful that you will not only want to make an investment into the future of those we serve, but that you will want to become an ongoing partner in our movement to enhance collective impact. So by a show of hands, how many of you were born in Washington? It's hard to, whoa, less than about a third of the room. Well, I am proud to be from the Evergreen State, but there's a lot about our state that I'm actually not proud of. For example, last year, there were 6,000 confirmed cases of abuse and neglect. 9,000 children were in out-of-home or foster care. 24,000 birth to 3-year-olds were eligible for early intervention but not able to access it. 39,000 children were reported as maltreated. And there are 226,000 children right now in our state living below the federal poverty line. Washington, we can and we must do better. Sadly, nearly every trend affecting children and families in our state is getting worse, as made even more evident by these recent local headlines. For example, a new baby is born addicted to drugs every 19 minutes because of the increase in maternal opioid use. The number of homeless children has doubled in just the last 10 years, and over half of our kids aren't ready for kindergarten. There are still widening health disparities in children of color, and referrals to CPS are increasing, as are mental health issues in children. Teen incarcerations are up by a remarkable 500%, and teen suicide is now at a 30-year high. For the first time in 3 generations, there is a shocking decline in life expectancy in America. The data is clear. Yesterday's strategies are not working. Significant changes will be required, and there has never been a greater need for Childhaven. These trends and statistics, they're not only affecting marginalized communities, as we might like to believe. In fact, they've deeply affected me and my family and many others in this room. And even if you haven't been touched directly yet, you have been indirectly by the tune of about $585 billion. This is due to the increase in the cost of special education, the justice system, and mental and physical health care. It's costing all of us. To assess why outcomes for kids and families are getting worse, it's helpful to get a snapshot of what the ecosystem we operate in actually look like. So imagine for a minute that you're a single parent, maybe a 4-year-old and a 2-year-old. You've experienced domestic violence, both as a child and as an adult. You're battling anxiety and severe depression and a substance use disorder. You make minimum wage, you don't have a car or stable housing. As a result of the trauma that your children have experienced, your 4-year-old has violent outbursts and has been kicked out of every child care and preschool they've gone to. And your 2-year-old cries uncontrollably anytime you put her down. Both have fallen behind their peers developmentally, and you know in your gut that the gap is widening on them every day, but you don't know what to do about it. Your family clearly has many needs. But unfortunately, there's a shortage of providers, especially those who are trained to support families experiencing trauma. So you are referred from one provider to another, and another, and another. Nearly everyone has a wait list. When you are finally able to get in, you have to relive all of the adversity you've experienced as you repeat a duplicative intake and assessment process at each new organization. Most of the providers aren't communicating with each other, using the same data system, or even working towards the same goals and outcomes. It's all very complex, chaotic, Instead of helping, it actually adds to your anxiety and depression and stress. So you miss appointments, and none of you are able to get what you need, when you need it, or where you need it in order to reach your full potential. Above all, you feel like you failed as a parent, yet again. Is it any wonder why outcomes for kids and families aren't improving, and so many children and families in this community are falling through the cracks? So our board and staff decided to take a look in the mirror. How could Childhaven help simplify this chaotic and complex system? How could we streamline access for more kids and families? And how could we drive systemic change in this community? First of all, we recognized that we needed to add more science-based and heart-centered services. Historically, the children and families who have been referred to Childhaven were able to only get one or two of the services they needed to reach their full potential, and we had to refer it all over the Puget Sound so they could get the other services. Now, as you just saw in the video, families are able to get many of the services they need, if not most. And not only are we providing a much wider array of family-focused services than we ever have before, we are providing them to substantially more children and families. Remarkably, by the end of this year, we will be serving twice as many children and families as we were the same time last year. Okay, it says applause, yeah. Thank you. It is unprecedented growth in our 110-year history that in 1 year we can double the number of kids and families we are serving. And that is made possible because of the support of you, our community. So please give yourselves another round of applause. And while we are tremendously proud of our growth and very grateful to those who have made it possible, we still can and must do better if we want to reverse those trends and change those headlines. But we recognize we can't do it alone, which is why we are developing a collective impact approach, which includes partnering with other nonprofits, as well as corporations, government, universities, hospitals, and of course, philanthropists, such as yourselves. What if, instead of this complex, chaotic, and siloed system, families were able to actually be in the front and center of our focus? What if we could have one centralized assessment process and every family had a navigator to help them triage their needs? What if primary health, behavioral health, and social services were actually well coordinated and aligned with goals and outcomes that worked for the family? Above all, what if they could seamlessly get what they needed, when they needed it, and where they needed it in order to reach their full potential? The good news is it's starting to happen. Today, I'm very lucky to be joined by friends and fellow CEOs who are also working at forward-thinking organizations who are ready to develop new and innovative ways to increase their collective impact. So could you please give them a round of applause over here?